it is a tricky problem. What I can say is that Australia, because we've done a lot more testing than other countries before the thing hit, we've actually got a much, much better picture of where we are. So we're not, I don't believe, in anywhere near the situation of Italy and the US, which basically were barely doing any testing. And so basically they were flying blind right off the cliff. So we're in a better position, but that doesn't mean we don't get this absolutely perfect. And so the whole aim at the moment, and I can tell you that the governments are very, very much cognizant. They're trying to match it so that the peak of this, so when the actual peak comes into it, that is actually going to be around about equivalent to the amount of resources we've got, which is in terms of healthcare beds, hospital beds, and things like ventilators. Now, the issue with it is trying to match the two things. Now, the responses are, from this side, is whether our sort of decision-making in terms of clamping down in the community, for which we all have a responsibility. And I can say, can we please start giving the evil eye to people that are not sticking with the program? But we need to sort of clamp that down and make the hard decisions, and they're ramping that up so that hopefully when it hit that peak at the end will actually be around about the same. And the government are trying to increase this as well, which is the amount of capacity, by trying to make sure that they have enough things like ventilators and healthcare.
All right.
So I think overall we're doing as well as you can be. That's what I'd say.
Yeah, we'll keep asking that, because that's obviously a fluid situation as we see these cases come in. But some encouraging news there, if you're worried that Australia, at least the testing early, means we have a better, I guess, read on this than some of the other countries that saw these sudden surges. You mentioned there the clamping down. The government announced some non-essential services would be shut down. A lot of people raising their eyebrows about allowing hairdressers and beauty salons, for example, to remain open. What's your view on this as a public policy?
Yeah, that's an interesting one. It depends on how essential that is and, whether we all need our haircuts done. I totally understand that. I mean, with those situations, they're relatively small groups, and it may be possible to do a certain level of social distancing, but obviously not between yourself and the hairdresser. But I suppose in some ways that's the same thing as us in a healthcare facility as well. So look, I think it's a balancing act for them, and it is a ratcheting up type situation of trying to get the right balance and getting that commensurate control again to try and keep that sort of ultimate need and the ultimate peak of the need down. And look, I think at the moment that's reasonable, but just in the it may be something in the coming weeks, because I'm seeing in other countries they're starting to cross that off the list. And look, that it is a matter of actually steadily and carefully ratcheting these things up at the right time.
Okay. Also, a big issue being spoken about is how much we have in terms of supplies. The government yesterday revealing a batch of masks that were due to come to Australia were actually diverted to another country. How bad is the situation, and what's it going to mean, for example, for doctors wanting to be able to treat people?
Look, I must say, on the ground, that is probably the single biggest issue for us at the moment. I mean, I'll just show you now. I'm down to my last few in my box at the moment, and that means that I'm not going to be able to do any more testing, and I'm not going to be able to, basically treat patients who are going to be potentially infectious. When
do you know if you're getting the next one? What's the time frame for you?
A couple of days. We're hoping in the next couple of days. Now, I can tell you on the ground that is probably the biggest sore point at the moment, in terms of, for example, frontline workers. And it's not just frontline health workers, it's frontline GPs, it's frontline health workers, it's people like, aged care services, people have to visit patients at home. All of those people really need these. And so we need to see some transparency and some assurance that they're here, because that is going to be a critical thing. It's one of the major ducts that the government needs to align, along with things like ventilators and the hospital beds and the training for the right people. That PPE issue, we need to see some assurance, and we would like to see more assurance from the government that it's getting done.
All right, we'll keep asking that. And just finally, you mentioned aged care. There's a lot of concern, obviously, for people. They want to be able to visit their loved ones. They might be vulnerable. They might be lonely. You understand why that would be the case, given some of the issues with aged care in the country. Are people taking this warning seriously, not to visit relatives, at least for now?
Yeah, look, I think this is an emerging issue, and I understand. I go to aged care facilities. I go I've gone every week for the last 25 years, so I understand the sensitivity of needing, to see your loved one and that loved one not being lonely. But unfortunately, we've seen some pretty scary behaviour in the last little time since even the restrictions have come in. People coming from, say, overseas, from at-risk countries, demanding to break isolation to go see their family, who may, in fact, be dying even. And also, quite aggressive behaviour by relatives at the moment. Look, this has got to stop. I understand the sensitivity of this. I understand how hard it is in these situations, and we need to find a way to deal with that side of things. But the aged care group is the single biggest scary group, because it's like trying to throw a match into a bunch of firelighters with this, because they are going to be the ones with the highest risk and the highest death rate. So we need people to stick to the rules and respect them.